Hey everyone, in this video we are going to talk about how you can become a good health educator. Welcome to CASRN, where I teach you about all things nursing. In this video we're going to talk about a needs assessment and how you would do that, various learning styles and preferences, and then how to come up with a personalized education plan. So a needs assessment, I've got other videos that talk about a needs assessment or a community assessment, but let's talk about doing this one-on-one. First off, we want to identify the needs of our patient. We want to take the time to get to know our patients so that we can give them the pertinent information that they need. This gives you the information that you need as well, which helps build rapport with your patient. We want to talk about barriers. Is your patient going to be able to do anything with the information that you're giving them? Are they able to cognitively understand? Are they literate? Are they motivated? Do they have access to be able to get those things? We also want to evaluate their readiness. Is your patient in a place where they can learn? Part of being a good community health nurse, and really just a good nurse in general, is evaluating your patient's readiness to receive the information that you're trying to give them. So for example, you have a patient in the emergency department that just came in with a broken femur. Are they ready to hear your education about walking with crutches? No. And I know this is an extreme example, and hopefully nobody with any common sense will be like, oh, this is a great time to show them how to walk with crutches. But I'm hoping it makes you chuckle and to hear that, because you're thinking, well, no, of course not. I would never do something like that. Like, we've obviously got other needs ahead of that. So this is to lay it out like, hey, sometimes people aren't ready to hear the information that you're going to give them. They're not ready to make the changes. So when we're looking at community health and educating and behavior change, is your patient in a good physical situation? Are they emotionally able to hear you and understand? And what level of knowledge do they have versus what level of knowledge do they need? So after teaching, it's also always really good to make sure that you do the teach back method with your patient. So make sure that they understood what you said and that you explained yourself well. So I typically ask, would you please tell me what I just taught you in your own words so that I can make sure that I explained myself correctly? We don't want to put blame on the patients for not understanding. So our job as a community health nurse is to teach the material in a way that the patient understands, not for our patients to understand our teaching method. So you may need to modify how you present information in order to meet the needs of your patient. So I've got a video on nursing theories that goes into this general concept a lot more about assessing your patients and the different theories that can help you come up with steps to do an assessment. But basically, we want to use those theories here to assess the needs of our patients and how we can best help them overcome their perceived barriers. So part of your other job in helping your patients make changes is to find what works. So we need to do our best at meeting them where they are and find out their preferred learning method. So by now you've probably been through a lot of education, so you probably have an idea of what you prefer to use to learn. I personally am a visual learner, which is why I started making these videos. Being able to see the words helps me keep them in my memory. So I need to be able to visualize. I am bilingual and I speak Spanish. When I was learning Spanish, if someone just told me the word, I couldn't remember it. But as soon as they wrote it down and I was able to see it and visualize it, then I was able to retain that information so much better. So our goal as a community health nurse, or just really a nurse in general, is to help our patients retain that information as much as possible. So one tool in our tool belt that we can use to do that is finding out what their preferred learning method is. So then you can present the material in a way that they can best retain that information, and your education will be a lot more successful. So this also goes to show that if you were to work in an education area like a health department or something like that, you want to make sure to include various learning methods inside a presentation or within a topic. So let's say you're tasked with creating education materials about tobacco use. So what could you use for a visual learner or a hands-on learner or an auditory learner or a reading learner? So I would love to hear your ideas. Please share them in the comments below. Now, an education plan. I cover this material in large scale in program planning video. What you're going to do now is implement each of these steps on an individual basis. That's the beauty of community health nursing. It can be for the entire community or just for one individual, and the steps are the same and it's completely scalable. So to come up with a plan, we're first going to set our goals and objectives. Goals are a broad outcome, while objectives are smaller outcomes underneath each goal. So we want to make sure to set these goals with your patient. Don't do it without them. They won't have any buy-in if they think it's just some generic plan that you're throwing at them. They need to be able to discuss this and figure out what they can do in order to make changes. Then we can recommend an intervention. This might look like an evidence-based program. It might look like creating your own individualized program to meet the needs of your patient, and then we do it. So during and after implementation, we always want to evaluate the plan. Is it working? Do we need to make adjustments? What are some barriers that have come up that we didn't think about before, and how do we need to readjust? Okay, so just a quick review on this really quick video. A needs assessment is where we're going to go in, we're going to meet our patient, we're going to see what's going on with them, and we want to not only assess their physical well-being, but we also want to assess their mental and emotional well-being and figure out where they're at to see how much of an intervention that we can provide. Are they at a place where they're ready to make some changes in order to have a better quality of life? We want to, if at all possible, learning styles is really valuable in teaching people new information. If you can present it in a way that they prefer to hear it, then they're more likely to have it sink in. And then, as much as possible, we come up with personalized education plans in order to help people make informed choices that are personalized to them, and then they can work with you and with their provider in order to make positive changes and have more positive health outcomes. Thanks for tuning in. Please help me grow my channel by clicking subscribe and follow below.